All right, Cycling's last video here about adulthood and old age. So I'll start with late adulthood and then get into death and dying. So our objectives for this one are to identify changes that occur in health and life situations and then summarize kind of how everyone changes and adjusts to old age. So kind of our attitudes towards aging have kind of changed. So gerontology has kind of developed as kind of the study of aging, and this is a newer field in the study of psychology and kind of understanding the processes that people go through socially, emotionally, and physically in old age. So again, like we kind of talked about with the theories a few videos ago, most of those ideas are based on what's called the decremental model. And so kind of progression of aging kind of makes those physical declines and mental declines inevitable. But we also see a great deal of what's called ageism, which is prejudice or ignorance about the experience of the elderly and how that kind of influences people. So we see a lot of ageism in hiring and in workplaces, and that's kind of something that people are trying to combat. So some people assume that as you get older, you have poor health and there's more health complications, and that they kind of have these misconceptions of being inflexible or unwilling to learn or senile. They're going to forget things. And so that kind of influences perception toward the elderly. We also talked about in the last video sexual behavior and sexual activity, that it does not kind of change. But that's not true. Like it does change, but doesn't decline. So as it says here, the best predictor of future behavior is past behavior. So if people were very sexually active in their younger years and in the middle ages or their middle kind of range, then they're going to continue to have, a decent level of sexual activity. Even though kind of as you get older, sexual expression and, expressing your sexuality usually is discouraged the older you get. And so that does tend to kind of influence people's kind of talking about sexual activity and sexual behavior as they get older. But it's still occurring. So take that for what you need it to. We also see that usually over the age of 65, people that are healthy in their youth tend to be in good health. Obviously, there are things like cancer and other things that are, that are non-preventable. But for the most part, if you're a healthy person, you'll continue to be healthy in your older years. In the elderly, though, there are some chronic diseases that come about that kind of come with aging. And those are heart disease, hypertension, which is blood pressure, diabetes, and arthritis are all chronic diseases that usually occur the older that you get. And the three major causes of death among the elderly are heart disease, cancer, and stroke. And again, those can happen in younger years, but they become more prevalent. So one thing to kind of think about as you think about aging and kind of the ideas toward aging is for younger people, you always want to be older. When you're growing up, you're like, oh, I wish I was 17 when you were 13, or I can't wait for college when you're in high school. And when you're in college, oh, I can't wait to be an adult. And so those changes or transitions, the younger that you are seen as positive. But once you kind of hit middle ages and then you kind of start to go and get older, those transitions for older people are seen as negative. Like, yeah, I get to retire, which is positive, but then I don't get to go to work anymore. Or, my kids are leaving the home and I no longer get to take care of them. And so generally speaking, transition for older people are seen as negative. So kind of just keep that in mind when thinking about aging. So the last topic we have here is death and dying. And that is the last kind of topic that deals with old age. And so dying is inevitable. It will happen to all of us. And kind of how we deal with it is really based upon several factors. So in mental functioning, we talked about the intellectual ability doesn't change a whole lot. But there are two things that you kind of need to understand with changes in intelligence, and that is crystallized and fluid intelligence. And we'll talk about this again when we get to the intelligence unit. All right, but crystallized intelligence is using the knowledge and learning that you have in appropriate situations. And then fluid intelligence is solving problems. So crystallized intelligence, kind of think of that as like facts, and fluid intelligence is using problem-solving techniques. And so kind of as you get older, depending on the diseases that you may have or other physical changes, those things stay the same, but some diseases such as dementia and Alzheimer's disease can affect those intelligences and your ability to cognitively develop. So senile dementia is memory loss, forgetfulness, and declining in the ability to think. And part of senile dementia is Alzheimer's. So not everyone that has dementia or senile dementia has Alzheimer's, but it is the most common form of dementia. And this destroys your ability to think. So it causes severe decline in brain activity and damages to the brain. And unfortunately, there is no cure. And so although it is common, not everyone gets Alzheimer's, but it is becoming a lot more common. And it is very difficult for both the individual to deal with as well as the family caregivers and caretakers. So now if you imagine every day you don't know what you're going to remember or who you're going to remember, and every day is the people that take care of you are strangers, and that can be kind of difficult. So we also have then this ability to kind of deal with death. Talk about adjusting to death. One of the main kind of people we have is Elizabeth Kubler-Ross, and she kind of had this idea of how we react to death. And it's kind of the same as our process of dealing with other traumatic situations. So kind of the first thing is like when you get diagnosed with a terminal illness or like you find out that you're dying, the first one is denial. All right, so according to Ross, like the first step is denial. Like this isn't happening to me. There's no way. It can't be right. All right, and so that is the first step. And then once we get past the denial step, we enter into the anger step of kind of the why me, if you will. And you kind of start to alienate yourself from other people because you're just angry with the situation. Then you get to the bargaining stage, which is where you're like, if you believe in God or have a higher power, like, okay, God, if you spare me of this death, I will pray, or I will be good to my family, or I will do this, or I will do that, and kind of trying to rationalize and bargain with fate. Then once you kind of accept the fact that like this is going to happen, you can sometimes go into a depression, and you're aware of the losses, aware of how it'll affect you, how it'll affect your family, things that maybe you could potentially miss out on. And so that is kind of an issue. And then after we get over the depression, and you kind of come to the accepting stage. And so once you start accepting things, the struggle is over, you get it and you're okay with it. And that's generally where you find the most peace. And so some of the criticisms of this obviously are, you can progress through stages, you can go back and forth, and especially people that are diagnosed very quickly, and they don't have a whole lot of time left, how quickly they progress through those stages. And then the last kind of topic that we have with death and dying is hospice service. And what's interesting is that people are oftentimes afraid to talk about death, even though it occurs with all of us. Every one of us is going to die eventually, but we're very, very terrified or afraid to talk about it. And most people live until, especially in American culture, in their 70s, like 75 and 80s, and it's not uncommon to be in your 80s and 90s and still be alive. And so with hospice care, which is care for people that are in their later stages in life and that they are dying, it's not so much anymore to treat or cure an illness. It's more to make them comfortable and to make their surroundings pleasant. And it's kind of this new movement to restore dignity. So with hospice care, there's in-home hospice where nurses come and you stay within your home and they make sure that your medications are right and that you're eating and that you're comfortable and you're not in pain. And then there are hospice facilities if the home is not appropriate. And so you actually would go and live in a hospice with round-the-clock care to make sure you're comfortable. So that's our conclusion on old age and death and dying. So thanks for watching.